Hello, welcome to ANA community. In this particular video, we are going to discuss the examination of neck. From the past several videos, we are discussing the components of a general examination, significance of a general examination, and the method of doing the general examination, and certain parts where the general examination plays a major role are being discussed. Today we are going to discuss the examination of neck. When we speak about the examination of neck, this is the method of examination of neck. So initially we are going to look into the uh, front part of the neck by coming in front of the patient and look into the texture of the neck, any swelling is present or not. After that, we are going to the back of the patient to do the examination, specifically palpation of the neck swellings. In this further, we are going to look into some of the major aspects of abnormalities in relation to the neck as such. In this particular example, the lady is presented with breathlessness. So, of course, she has put her hand on the chest, but look at her, the neck, sternocleidomastoid muscle, they are very active. Of course, the lady is also having open mouth. There may be a possibility of movement of the alae nasi also. So all these are indicative of the lady is presented with the severe form of breathlessness. So which is specifically seen in case of either cardiac diseases or respiratory diseases. This is a thyroid swelling. Of course, so this can be examined when the examiner is present behind the patient, posterior to the patient, then only this borders, etc., that can be examined well. This is indicative of a surgical scar, of course, where the thyroid swelling was being removed. These are the four images, different forms of the thyroid surgeries. This is considered to be where the cursor is moving. That is considered to be a lymph node, which is termed as virtuous lymph node or virtuous node, which is specifically seen in intra-abdominal malignancies or pelvic malignancies, wherein the tumor cells, they are coming via lymph nodes of the respective areas. From there, it will be entering into the lymphatics, then to the thoracic duct. Later, that will be getting what do you say? That will be getting transferred or deposited in the left sternocleido. That is the lymph node which is present in the left sternocleido. The lymph node that is present, this is considered to be virtuous node, which is indicative of intra-abdominal malignancy, wherein the malignant cells, they move from their origin through the lymphatics into the thoracic duct and gets deposited in the the clavicular region on the left side. This is a lymph node swelling, which can be examined with the 2 fingers, which will be just like bean-like structure can be seen. Of course, this may be present in case of infections as such. Whereas in case of the malignancies, it will be hard swelling may be seen. This is considered to be distended neck veins, specifically seen on the right side, which is indicative of a visible jugular venous pulsations, where the right-sided heart failure, maybe right atrial failure or right ventricular failure may be present. Sometimes, in the absence of that, in case of superior vena cava obstruction, distended neck veins can be seen. This is a emergency situation. This is considered by tracheostomy. When the person is having tracheal obstruction, etc., then the tracheostomy is being done to facilitate the movement of the air from the exterior to the lungs. This is considered to be a torticollis. That means the spasm of the one part of the neck muscles. This may be observed in case of traumatic brain injury, in case of muscle spasms of the neck, or it can be seen as congenital abnormalities. The take-home messages from today's discussion are: neck, as regarding the other parts of the general examination, it is also an important part of general examination, wherein we are specifically going to observe any kind of thyroid swelling, lymph node swelling, distended veins in the neck, or tracheostomy in case of upper respiratory obstructions, muscular spasm in the neck, or varicose node. Dear ANM members, that's all for today. What are the major key takeaways from this particular discussion? Mention in the comment box below. And what is the one video that you would like to hear in this particular channel? Mention in the comment box below. And spread this particular video to maximum number of true Ayurveda learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.